My name is Manuel DaSilva. I'm an orthopedic surgeon at Lifespan Orthopedic Institute. I treat many different conditions. The most common probably would be carpal tunnel syndrome, moving up to the elbow, tennis elbow, golfer's elbow. I have pioneered some minimally invasive techniques in order to treat those conditions. And in the shoulder, for sure, would be rotator cuff problems. Orthopedic surgery, and especially upper extremity, deals mostly with functional activities. If you cannot use your hand, or if you cannot use your elbow or your shoulder, it makes a big difference in what you can and cannot do in your daily life. As an orthopedic surgeon, I like to restore that function so that I can bring my patients as close as I can to what they were before. The Lifespan team approach works. I've been very fortunate to have people that have stayed with me for many, many years. They're my colleagues, they're my friends, and they take as much pride as I do to get the best possible outcome. I'm also in the position to teach the next generations of surgeons, and I take that very seriously. And that's how I like to be remembered, as making an impact not just on the patients that I treat, but also making an impact on those surgeons that will do and will further the field in the future.